In your Restiffic box, you will find one pair of Restiffic foot wraps labeled for right and left feet, one pair of Flexor T-pads labeled for right and left feet. The Flexor T-pads will be placed in the wraps for initial application, 2 identical cover-ups, and 1 Restiffic care bag. Sitting on a chair or on the edge of the bed, open the right Restiffic foot wrap and lay it flat. The care label should be visible and correctly oriented so you can easily read it. Before sliding your foot into the device, identify the ball of the foot below the big toe. This is your landmark for correctly positioning your foot on the Flexor T-pad. Slide your foot into the pocket of the wrap so that the bottom of your foot is in direct contact with the Flexor T-pad. Position your foot so that the ball of the foot fits comfortably in the divot of the Flexor T-pad. Your toes should be exposed at the end of the wrap. Loop the middle strap through the middle ring and secure it to the hook and loop material. Repeat with the top and bottom straps. Adjust the straps to provide firm but comfortable pressure to the foot. Be careful not to tighten the straps excessively, as this may result in pain or numbness in the foot. If experiencing pain or numbness in the foot, loosen the straps of the wrap. Correct pressure is critical to the therapeutic effect of Restiffic. You should feel firm but comfortable pressure when the wrap is correctly in place. Confirm that the Restiffic is correctly placed on the foot and adjust as needed. Slide one cover-up over the foot wrap so that the entire device is covered. This will prevent the hook and loop material from snagging on clothes or linens. Repeat all steps with the left foot. Restiffic can be worn during any activity in which you are off your feet, such as reading a book, watching television, or sleeping. The device should never be worn during any activity in which you are on your feet, such as walking, driving, or running. To remove your Restiffic device, first remove the cover-up from the foot wrap, unhook the straps of the wrap, and fasten them back on themselves. Then slide your foot out of the wrap. The Flexor T-pad should be left inside the foot wraps for easy application when using next. Only remove the Flexor T-pads if washing is required. To reinsert the Flexor T-pads after washing, first identify the left pad and the left wrap to make a pair. Then identify the right pad and right wrap to make a pair. Slide the Flexor T-pad into the pocket of the wrap so that the divot in the Flexor T-pad is oriented towards the front of the wrap and the top of the T-shape is positioned in the closed end of the pocket. How do I know if my Restiffic is on too tight or too loose? If the Restiffic is causing you pain or numbness in your feet, loosen the straps accordingly. If the Restiffic is sliding off your foot, tighten the straps to a firm but comfortable compression level. How soon will I experience relief? Many patients report positive changes in their RLS symptoms within minutes of putting on their Restiffic. Some patients experience gradual changes over several days or weeks. For a complete list of frequently asked questions, visit the Restiffic website.